This video course tries to summarize the essential role of e-health and m-health in society and offer a case study for a better understanding of the information. Trying to understand how m-health and e-health impact society, it is essential to start from the general level of society to the impact on people's families and their work, the environment, underlying the providing health needs to take into consideration all the aspects of the lives of individuals, even if it is about the patients or the workers from the medical domain. We can start by thinking about how e-health and m-health impact the way people get their knowledge these days, including information about health, illness and treatments. M-health and e-health can be essential for people who live in isolated geographical areas. At the individual level, e-health can offer the patient more and easier access to medical services depending on his needs, and for the professionals more access to the patients. The medical staff can have easier access to the patient's data, communicate with them, consult them, prescribe medication, monitor the medication intake, and give the prescriptions directly through the pharmacy. People can easily join the community of patients with the similar medical issues to share their medical experiences for supporting each other and be in touch with the medical community. Doctors and nurses can share their knowledge worldwide, have more access to professional information, and participate in online conferences. Doctors can assist each other by using ICT devices to participate in challenging surgery activities no matter the distance, and can have feedback on complex cases from their colleagues based on advanced methods of investigation. As a part of a community, empowering the patient makes him the core of the medical care, but the implementation of m-health and e-health features can be challenging at all levels, and that makes important to take into consideration. Next to the technical difficulties, also social challenges including political and organizational aspects at all levels. The implementation of m-health and e-health always has to consider the stakeholders involved in this process, which are also defined by the social contexts but are at the base of the efficient development of healthcare through digitalization. Knowing the cultural barriers or facilitators of implementing m-health and e-health in a community can ensure a specific and contextual strategy, starting from the level of understanding of ICT utility in the health sector to the effective use of apps for improving health as one of the 17th Sustainable Developmental Goals of the United Nations. Now we will present a case study of a patient using his smartwatch and mobile phone to monitor his heart rate. The patient is FP, a male, 52 years old. He accuses from time to time chest pain and a high heart rate. He works in a big company. Sometimes he feels sick, and that makes him very anxious. Because he has a smartwatch, his doctor advised him to self-monitor his heart and send the data when the app signalizes anything wrong. He agreed with his cardiologist to take an EKG and to email it to his doctor if he feels something is wrong with his heart rate. On electrocardiography measurement, the smartwatch is giving precise instructions about how to use this function. First, it is indicated the position of the finger on the lateral key. The first message tells the patient that the watch doesn't detect heart attacks. Then the patient is informed about his arm position, so the measurement is valid. Then the patient receives feedback from the app. This time the message is that there are no signs of arterial fibrillation. What are the data the patient can send to the doctor? His name, date of birth, age, the cardiac rhythm general aspect. For example, our patient has a sinus heart rhythm, which means it is in normal parameters. The data includes the hour when the EKG has been recorded, the characteristics of the derivation that the smartwatch is recording, which can be useful for the doctor's interpretation. It is important to remember that while recording, the smartwatch displays explicitly the message that it was not designed to discover heart attacks. So if the patient still feels sick, he must go to the doctor urgently. These apps can detect by chance changes in the cardiac rhythm, oxygen level, for example, and alert the patient, who can send the information further to his doctor, without the need to meet him in person. If he sends the electrocardiography to his cardiologist, he can get feedback, and if there is something wrong, he will be notified to go for a more complex evaluation and a face-to-face consultation. This was just a short example of the smartwatch app utility. Can be used to monitor vital signs and to alert the patient if there are important changes. Can inform the patient about the need to move after 1 hour of sitting on a chair, the fat level in body, helping him to control his diet, the level of hydration, the efficiency of his sleep over the night. And also there are smartwatches which can measure the blood pressure. What is to remember is that even if these parameters are not very precise yet, The patient can be informed in real time about important changes and he can communicate with his doctor about these.